Hello, everyone. Thank you for joining us today for our webinar on Connect, Collaborate, and Write for your EMR with MedDialog. We will be muting this conference today. If you do have any questions throughout the conference, please feel free to ask them in the Q&A section on the bottom right corner of your screen. We will do our best to get to as many questions as possible before we finish up. Today's webinar will be presented by Tal Douglas, Telus Health's business analyst for MedDialog. Tal, take it away.
Perfect. Thanks, Ivan. Welcome, everyone. My name is Teo Douglas. I'm Telus Health business analyst for our MedDialog project. I joined Telus Health 6 years ago as a part of our technical support team for our MedAccess EMR out in BC. And since then, I've spent time working on EMR escalations, some inside sales work, and expanding our Telus Fiber Internet in Western Canada for our EMR customers. My experience working on the MedDialog product has been a great way for me to take that customer feedback I've heard from clinics over the years and use that understanding to then help improve this product. Today, we'll be discussing streamlining your clinic's external communications using MedDialog with eFax. I have a few slides to go through to explain what MedDialog is, how it works together with our eFax product, and how the two together can save you time and money on your external communications. We'll have a demo showing how a PS Suite user can send a MedDialog message out to another user and how that response comes back in seamlessly in the recipient provider's messages. Following that, I'll go over pricing information for MedDialog. As mentioned, we'll stop for a few opportunities for questions, but feel free to use the WebEx chat functionality at any time. For any questions that we don't have time to answer, a Q&A document will be emailed out at a later date. So what is MedDialog? MedDialog is a secure messaging solution for provider-to-provider communication. So again, doctor to doctor. We built this into your existing EMR workflow today. It was really important when we were building MedDialog. We went to the PS Suite team and we asked, how would a physician print or fax a letter or some form of chart information today? What does that look like? We took that information and we built MedDialog in essentially just right alongside to ensure the process is intuitive and it doesn't require you to learn a new section of your EMR, go to a new functionality. We tried to build that in and make it as intuitive and easy to use as possible. You're able to send an unlimited number of messages for a flat rate, whether they're MedDialog messages or eFaxes. So you have no concerns about how many pages you're sending or any sort of overage charges when you're sending by fax or by MedDialog. All communication is kept within the patient chart using an integrated workflow you're used to today. Again, in PS Suite, we built in MedDialog and eFax right into your file menu, and incoming MedDialog messages arrive in your EMR messages. MedDialog supports sending full resolution attachments with support for documents, audio, video, and other file formats. In simple terms, this means the quality you send is exactly what the other end receives. There's no grainy or blurry items. If the fax machine didn't quite align it right, if you send color, they receive color. If your document has any selectable text, for example, like a PDF document, that'll come through the exact same way on the other side. So any sort of selectable text is available to the recipient as well. However, if your recipient isn't on the MedDialog network, we do have that Telus eFax solution to then automatically package and send your message as a fax without any extra clicks. So why did we create MedDialog? We wanted to create an open network that supports patient care dialogue between physicians, specialists, and other healthcare providers. The network currently supports physicians, specialists, nurse practitioners, and basically any allied health professionals that use a Telus EMR today. MOAs and other office staff can absolutely send and receive messages on behalf of those physicians, nurse practitioners, specialists, etc. Today, MedDialog is fully integrated with PS Suite, MedAccess, and Wolf, and our Quebec EMRs, MediSync and Kinlogix, will be live on the network next month. We've started expanding our network beyond Telus as well. We've started with a partner called Bright Squid Secure Messaging, which I'll discuss a little bit more later. But essentially, we are actively working on integration into other existing provincial networks to create a larger connected ecosystem outside of Telus Health. When we were individual EMRs, this kind of solution wasn't really possible. But with the backing of Telus Health, we now have the capacity and the users to start to build this type of larger network. Apologies, I just realized I had my slideshow paused there. Sorry, so just going to back it up for a moment here just so we can, again, see the slide. I'm reiterating quickly, the communication between providers is right in your EMR. Again, the unlimited number of digital messages that you can send, and all communication history, again, is kept within that chart. And just advancing to the next slide here. Again, this is kind of who we connect today: physicians, specialists, allied health professionals that use the Telus EMR. Again, we have the integration with PS Suite, MedAccess Wolf, and our Quebec EMRs next month. And again, I was just discussing how we're looking at building this outside of Telus Health. We know that providers are communicating with multiple portals and endpoints constantly. So our goal is to give you the ability for your external communications to go to these external portals and services using your current workflow and have those responses come back in directly into your EMR. I know it can be hard to kind of wrap your head around, like, what is this network? What is MedDialog? So a real-life comparison we like to use is Interact e-Transfer, which supports sending money between multiple banks with a single workflow. So if I want to send my money from a Scotiabank account to my friend's RBC account, Interact facilitates that transfer. And so MedDialog is aiming to create that same type of open platform where MedDialog is the piece in the middle facilitating that communication with other doctors, clinics, or EMRs, regardless of what platform they're on. And you, the user, don't have to worry about how that's done. You just go to your EMR, you find the person you want to send to, you hit send, and we figure out how to get it there. So let's go over the typical MedDialog messaging workflow. Let's pretend you're sending a referral letter to a specialist. In your EMR today, you would access that patient's chart, you would create that letter, and then maybe print it off. With MedDialog and eFax, you'll still follow those exact same steps, but instead of printing, we've created a new send option, kind of a menu option right in your existing EMR workflow in the file menu. We know that at first, most recipients may not have MedDialog, and our industry is obviously built on fax, and we know that. So when you click that send button, you don't have to think about how it's sent. We're going to take a look at the provider, the recipient provider that you've selected, and automatically send in the best method possible. So if you choose that you're sending to Dr. Smith, if Dr. Smith is on MedDialog, we'll send it that way. But if Dr. Smith isn't, then the same menu option will then generate a fax to Dr. Smith and send it accordingly. If both providers are on MedDialog, when that provider replies to your message, the response comes back into your EMR and is automatically attached to the patient chart. This also then creates a message thread, which allows you to track and facilitate conversation if there are multiple providers involved. Another great feature of MedDialog is the fact that it supports discrete data in the sense of patient demographic information. So when we say discrete data, we mean EMR readable, machine readable. So in kind of simpler terms, this means if you're sending a patient referral to a specialist that hasn't seen a patient before, MedDialog attaches that machine-readable patient demographic information in that electronic format, so the receiving EMR can then automatically create a patient chart with the latest up-to-date patient demographic information already populated. The same applies if you receive an incoming MedDialog message with a patient your clinic hasn't seen before. This means the recipient doesn't have to manually create that chart and transcribe the patient's PHN, date of birth, first, last name, all the demographic information. You no longer have to type that out and transcribe that. It's automatically bundled in a message if both parties are on the MedDialog network. This is a huge time savings for support staff, but again, only available if both the sender and receiver are on the network, as fax technology doesn't support this today. Some of you may be familiar with our Telus eFax product, which has been a pretty popular PS Suite add-on for some time. For those that aren't familiar, I'd just like to highlight a few key features. At a very simple level, eFax is sending your clinical faxes over the internet instead of having a phone line in your clinic hooked up to a multi-purpose fax machine. eFax allows you to keep your current fax number, but port your number to our eFax solution and have the option then of saving money on your hardware and supplies and your recurring costs, because you no longer have to pay for a local service provider like Bell or Rogers for the monthly service for that line to maintain that physical fax machine and physical fax line. You never have to worry about your line being tied up or sending multiple faxes at once. Digital faxing supports simultaneous sending and receiving. eFax integrates directly into your PS Suite address book, so any existing providers you have entered with a valid fax number can be sent to on day one. You can verify your faxes have been sent successfully by viewing the message status directly in your EMR. It's essentially eFax is a very essential piece of our external messaging with MedDialog because the two work together to send your message using the best method possible. We also understand that some of you may be using some form of an electronic faxing solution today, but where Telus eFax really sets itself apart is the level of integration into your EMR workflow and having that address book integration automatically set the destination fax number based on the provider you've chosen from your address book. Our teams are happy to look at your current faxing product or faxing solution and do a bit of a comparison between the two and help kind of highlight the differences. Just highlighting on the slide here as well, so incoming faxes import directly to a local PC or Windows workstation, and outgoing faxes can be sent with that new menu option built right into your EMR. I'm sure a lot of you are familiar with the challenges surrounding communication related to patient care today, but we've collected a few key stats to highlight why we think MedDialog is a meaningful improvement to primary care. If you think about the amount of time you spend faxing, calling, or even mailing specialists today, and how sometimes that communication is lost, or you just don't hear back from them, a study done by the CFP Journal indicated that approximately 21% of requests for consultation never receive a response in Canada. With MedDialog, if both the sender and receiver are on the network, you'd have a delivery receipt and peace of mind knowing that the item is in their EMR awaiting their response, rather than lost in transmission, like a fax that got misplaced or a letter that maybe wasn't open. We've also noted that 50% of all adverse events related to primary care physicians were associated with communication, as our physicians don't have the tools to properly communicate that important health information. Just one last slide before we get into the demo here, and I'll stop for questions shortly. But again, to expand on that last point, in many cases, patients aren't just seeing one provider. Some patients may have several providers involved in their care. Today, it's difficult to communicate with several providers at once, as fax, mail, and phone calls all tend to be a one-to-one communication. You pick up the phone, you talk to one person, essentially. Faxing does allow you to send to multiple recipients, but if one provider sends the results fax back, how does that get communicated to all providers on an original request? So that's where MedDialog supports what's called message threading, which allows everyone to follow the discussion so all providers involved can see all messages to date. Message threading is exactly what you're already used to in your emails. In Outlook and Gmail, if you CC a user or reply all, everyone included on that thread gets updated with the full history. And we've essentially built that same functionality into MedDialog just to form that same type of collaborative discussion. Again, this obviously works best if all users are on the MedDialog network, but even today, you can still create a multi-recipient message. If some recipients are on MedDialog and some are fax recipients, we'll package all relevant information and send it to all parties. As an EMR user, your focus should be on patient care, not on managing your external communications. So I will stop here just before going into our demo and just check to see if there's any questions in the WebEx chat. And again, feel free to pop open that chat button and just make sure you're sending that to everyone. Yvonne or Patrick, you thought I'd stop and check for questions.
Yeah, so I see here we have one question. Does MedDialog provide an interface for e-consults?
Yeah, so MedDialog does support e-consultation fee codes, so I will get into that shortly. As far as an interface goes, I mean, essentially for e-consultation, we just want to make sure that both the consulting and referring physician, that both of them are on a secure electronic network. So by you sending a MedDialog message to a specialist, that is considered an e-consultation and that can be billed accordingly. So I do have a slide after the demo that goes over the fee codes and a bit more information on e-consultation specifically.
The next question I have here is this going to replace my fax? How do I send non-patient faxes?
That's a good point. So you have the option for the eFax product. There's a few different ways we can configure eFax. If you'd like to keep your physical fax machine, we can certainly set up either a separate fax number for eFax or some sort of forwarding setup. There's a few different ways we can configure that, and our teams can go over all those options for you. But essentially, yeah, if you did want to completely port your number to eFax, we can do that so that you no longer have to pay, Bell or Rogers for that number. And our teams can go through. We've put together some videos, and I'll highlight those at the end of our presentation today. In the PS Suite help files and the help documentation, we put together some video libraries showing, how to send a fax related to a patient, non-patient related, et cetera. So we've got a few of those kind of demos highlighted there.
I have two more questions here. The next one is, did you say that if the intended recipient is not on MedDialog, it will automatically attempt to send as an eFax? That's
correct, yeah. So essentially, you select the person you want to send to. So you select Dr. Smith, and PS Suite will look at whether or not Dr. Smith is on MedDialog. If yes, it'll send that way because that's preferred. But if no, it'll use the fax number on Dr. Smith's address book entry and send to that fax number by eFax. So it'll select for you whether or not it sends over MedDialog or eFax.
And the last question I have here, which seems to be a popular question, is how connected are physicians in Toronto regarding a MedDialog? Example, how many specialists are using MedDialog versus primary care physicians?
That's a good question. We get asked this a lot for exact numbers on how many, in each city and each region. Because of the terms and conditions for the service, we can't share those explicitly right now. But if you contact us, we can help kind of give you an idea around kind of how many users are in your area. But again, we do understand that initially with this network, the value will be on that eFax product until we get enough people on the network that you start to create that network effect, right? Essentially in the beginning, the first fax machines that came out didn't have a lot of use because there isn't anyone else to send to, but we are pretty aggressively investing and activating people on the MedDialog network to build that out quickly. So if you contact us, we can definitely go over the details for your area.
I think one more question came in. It seems to be that it's not so much a question, but it looks like sending eFax currently is not very clear. So maybe when we go through the demonstration, if you go through that, seems to be one of the questions here, as well as do specialists get paid? I'm guessing on the e-consult side of things.
Okay. Yeah, for e-consults, the specialists definitely do get paid. So I'll highlight that in the slide coming up with the exact fee codes and what that looks like. For the e-faxing specifically, let me see what I can pull up and we can go over it and review that.
Okay, that's all we have for now. Yeah.
Awesome. Well, again, if anyone else has any questions, even while I'm presenting, throw them in the chat. Yvonne will take a look and we'll make sure to get those answered. Anything we don't get to, we can follow up with that Q&A document. So I'm just going to pause my screen for a second here and log into PS Suite, and we can pull up the kind of demo environment there. Okay, so just confirming that everyone can see my screen, and I'm logged into PS Suite on a patient chart here. Yvonne, is that showing on your side?
Yeah, I see it here perfectly.
Okay, perfect. So I'm logged into PS Suite, and what I'm looking to do here essentially is I'm a doctor and I'm creating a letter to another provider. So I'm on my Frank test patient here. Obviously, this is all test data. None of this is real information, and I'm not a doctor, so I'm not going to write this exactly how someone else may, right? But just showing you the exact kind of functionality and the steps we would take to go through and send an outgoing MedDialog or eFax. So I'm going to go ahead and create a new letter here. And of course, when we create a new letter, as we're used to today, it's asking who you want to address the letter to. Give the to field and the CC'd recipients as well. MedDialog does support sending to up to 11 recipients, so one primary person and up to 10 CC'd users. So you can absolutely go through and CC additional users here. When I'm picking who I want to send to, I'm going to click to pull up my, my address book here. And so when I pull up my address search, you may notice something a little bit different here. And that's that we have a new tab here that's called Provider Registry. So I'm going to pause here and kind of explain. So as a part of MedDialog, when we were building the product, we kind of thought to ourselves, how can we kind of put together a list of those people that are on the network, that are on MedDialog? And so we started creating what we call our Telus provider registry. And so the provider registry essentially is a Telus-maintained list of providers that are on the MedDialog network today. We are looking at even building out that provider registry further to potentially kind of include more even providers that may not be on the MedDialog product, because we know that kind of managing your local address book and not really knowing the source of truth for that is a struggle for a lot of clinics to keep their address book maintained. So this is kind of a first step into creating a form of kind of a Telus-maintained centralized address book for provider demographic information. So as a part of this, when I pull up my address search, it's showing me my favorites. I'm logged into a test environment, and I've got someone here. I've also got my local address book that I can scroll through. And you'll notice some icons here showing. So because I've got eFax and MedDialog enabled here, in my local address book, I've got a column here that has some fax icons. And so that shows that I have a valid fax number entered for this provider, and I can send to them by eFax. Anyone else in here, for example, some of these pharmacies don't have a valid fax number entered, and so I'm not able to send to them today. But anyone that gets populated with a valid fax number will show that icon. Anyone that's then actually on the MedDialog network will show a little bit of a different symbol, the MedDialog icon. So I'm going to go in here and search for a provider. Searching Alberta here. And so this is a test provider we put into the system. And so you'll notice here, this MedDialog icon shows the envelope with the plus sign. So that's our indicator that this person is enabled on MedDialog today. And so I'm searching the provider registry, and I can see this person, but I may also have this provider in my local address book. And so we have built in a form of kind of a background matching and merging process to, if some of your local providers or your favorites that you send to today do join MedDialog, we can then merge that MedDialog enabled kind of flag or indicator so that they are then able to be sent to by MedDialog. But again, anyone in your local address book that has a valid fax number can be sent to by fax as well. So in this example, I'm going to pull in Angela as my recipient, and Angela is MedDialog enabled. And again, I can add additional CC'd users if I'd like to, but for this example, I'm just going to keep Angela here. And so when I pull this up, I'm just going to put in a quick, just as a test. I'm not going to write too much here, but just highlights that when I am ready to now send this, again, in our file menu, we've got a new option there to then send that as, a MedDialog or eFax. So again, where you'd normally print, we've now built in this new functionality, and we've even assigned a keyboard shortcut to make that quicker. So again, as you'd normally print this, we can now send this. And so when I click to send this, we then get prompted with attaching items to this letter if we'd like. So of course, anything that we green bar or select becomes included. I can include profile information, graphing, lab tables, all sorts of stuff here. Essentially, if I wanted to, I mean, it's a bit of a different workflow, but you could essentially package an entire patient chart and send that by MedDialog as well. In this example, because I have that MedDialog enabled flag on this provider, it's when I click this button, it's going to show send via MedDialog. But again, if this is a fax recipient, it's the exact same workflow, exact same attachments. It will just send via fax instead. And so I'm going to go ahead and click to send. And so it's just generating kind of the output PDF that I'm sending. And now I get my message screen that pops up here. So you're used to seeing your messages, obviously, from sending internal PS Suite messages. So this is very much kind of similar. So a MedDialog message, I've got my recipient, Angela Ziegler, at the clinic that I'm sending to. So the clinic name will always show. The patient that I'm sending is attached here. This is all read-only because I've started this from my letter. I can now create a subject. I can assign a due date. If I want this as urgent, of course, ASAP. I can choose my reply to. So in this example, if I was an MOA or support staff, I can actually select which doctor I'm sending on behalf of. So if I work for multiple doctors, maybe this needs to be from Dr. Smith instead of Dr. Piper's, I can change my user here and do that. And this is definitely a new kind of portion that you'll see in the messages that you may not be used to today, is this little clip mark paperclip attachment icon. And so this is a part of a MedDialog message or eFax. So essentially, this is what we're packaging and sending off. And so as a part of generating that letter and checking off the additional items, it's now generated this chart items here. So I'm going to click to open this up and just show you what that looks like. And so this now opens up the preview. So I've got my letter here. This is a test, and it's also attached the additional chart information that I've selected. Of course, this is a test patient, so I don't have a ton of information here. But again, just highlighting that this is a full quality PDF. I can select text in here. This is not being flattened to an image. It's sending across as a PDF. I can add any additional information I would like here, any sort of message information. This comes across as, again, the actual message on the other side. I can also just include the chart items in the letter and send. One last thing to highlight with the attachments, if I wanted to at this point, I can also choose to attach additional patient chart items or a file from my workstation. It shows me that I have one attachment already, but I can also add additional here if I'd like. And so this is essentially the MedDialog portion in PS Suite. Like this is I know it looks just like a message, and it is a message. We've just kind of customized the message a little bit to suit kind of sending an outgoing MedDialog message. So I'm going to go ahead and click send on that. And I've got two screens here. On the other screen, it's showing that it's uploading and sending that message.
Let's do a pause and answer some questions if you don't mind, Theo.
Sure. Yeah. We had a lot of them come through.
Yes, we have quite a few here.
Okay.
The first one being, if someone sends a fax that is handwritten, how does that appear in the MedDialog/EMR?
Something that's handwritten. Okay, so that's a handwritten note that's then scanned in as an image, I'm assuming. I guess we can answer back. Yeah. So, yeah. Okay, so if something is scanned in, you would attach that PDF or that JPEG to the outgoing MedDialog message, and that would arrive in full quality on the other side. Obviously, because it's a handwritten message, the handwriting won't be selectable as text. That would come through as an image because that's something that you've scanned in rather than the EMR generating itself. But it would come across in full quality as, but if it's color, that would come across as color, but essentially a full quality photo of the scan.
Does the provider registry tab only contain those who are on MedDialog?
That's correct, yeah. So today the provider registry tab only contains anyone on the network. Again, in the future, we may look at extending that further because we know we do have the provider demographic information for a lot of our Telus doctors. We may look at kind of expanding that further, but today itself, that is just those that are on MedDialog. So if you choose to join the network, once you're on, you can search for providers in your area using that search tab. Again, if you have local entries or favorites in your address book today, we do have kind of processes in place to merge that information. So merge the MedDialog enabled portion onto your local entry. It's a little bit too detailed to show in this 1 hour session, but I can definitely show like a video where you can find the video and find more information on that.
If you click on needs printing, does it give the option for MedDialog or just print, fax, and email?
I'm not familiar with that workflow. Yvonne, maybe I can.
I'm guessing it's for like the staff. So if they put it as a note that needs printing, can they then send it out by MedDialog, or is it just a printout or?
Oh, sorry. Yeah, if something is marked as needs printing, they can still always go through here and choose to print or send as MedDialog or fax. So sorry, yeah, support staff like MOA and other staff can absolutely still use the MedDialog and eFax portion. They can still check that off and send that off as a fax or MedDialog. Absolutely.
If all physicians are on one instance, do they all have to sign on to this, or can they choose to do it on an individual level Most have their own fax numbers unless in a group practice.
Yeah, today the way we form the package, because the unlimited faxing would be shared by everyone at the clinic, we typically do ask that it's kind of an all or nothing, but if there are specific physicians that are not interested, please contact us and we can see what we can do to work through that. But we'll get into the pricing and I'll explain it a bit further in a slide coming up. But we do have a few options, so please reach out and we'll see what we can do to accommodate.
We were asking if you want to continue, we have a couple more questions here, but
actually, sure. Let's do a few more. I'd rather answer them now. Yeah.
We were asking if we could register a clinic as a recipient. We were told that was not possible as it has MDs/NPs. Will this be opened up in the future? eFaxing is great, but MedDialog adds the additional feature of messaging.
Absolutely, yeah. That's a great suggestion, and that's something we're actively working on this year. We've heard that a lot from our customers. So today, to explain the question a bit better, I guess, to those that are newer with the product, today on MedDialog, individual doctors at each clinic are listed on the network. So if you have a 3-doc clinic, all 3 of those doctors are listed, and you can send to your choice of one of those 3 doctors. But we've heard from our users overwhelmingly that I want to just be able to list my clinic, right? Like maybe I'm a walk-in clinic or I'm a clinic where we have like rotating MD staff. And so I just want to be able to receive messages to my clinic itself and then triage from there. So we've heard that loud and clear, and we are working on actively implementing that this year. So I am fairly confident we can have that in place within 2019. We have a few kind of efforts in place to move that forward. So we're absolutely working on that and hope to be able to offer that really soon.
Going back to the handwritten fax question, the client has clarified that how does it come up in the EMR if it's coming from another physician? Is it attached as an image into the patient chart or a PDF?
It would depend how it's scanned in, I think. However you scanned it into your workstation, so if it's scanned in as a JPEG, as an image, it would attach accordingly. So if your scanner is set to scan in as a PDF, it'll package and send it that way. But if your scanner is set to import it as an image or as a JPEG, it'll send accordingly. So MedDialog does support, documents, audio, video, photos, like all sorts of formats. So depending on the format you give the system, it'll just send it across exactly as it is. We try not to convert to PDF if we don't have to, because it can degrade the quality a little bit each time you convert. So it just depends on your local hardware settings for that one.
Do you need specialized equipment to be on MedDialog? If so, what is the cost?
So no local kind of equipment is required, with the exception of having one Windows or PC workstation in your clinic. Our eFax solution today does require like a Windows environment to grab those incoming faxes for you. That is, again, another thing that we've heard loud and clear is something that is hard to manage for some clinics that have like all Macs in their clinic. It's a cost to them to then purchase a Windows workstation. So we're working on removing that requirement this year. But for now, that's the only cost or hardware requirement to the clinic, is having that Windows workstation for downloading faxes. Otherwise, MedDialog itself has no hardware requirements whatsoever. It's all built into the EMR itself.
So I see a few questions about the eFax process. How are senders notified or alerted if their eFax does not go through, as well as are incoming faxes entered into the EMR, or are they left as paper on the fax BC? So maybe we can go through the eFax portion if you have a demo available.
Yeah, I have it recorded as a video. So I was hoping I can look back on that. Actually, let me see if I can pull that up now and kind of walk through. I apologize. The test environment I have here isn't configured with a live fax number, so I'm just not set up to be able to show the full workflow. But let me just pull up kind of an example video, and we can see if we can go through that and show a bit better. Just bear with me for a moment here. I'm just going to pause my screen and pull this up. Okay, so I'm going to highlight this later in the presentation, but essentially in the PS Suite EMR Health, under the More section, under training videos, we've got a whole section on faxing and on MedDialog. And so in here, we've put together some videos on like monitoring your outgoing faxes, editing faxes, and all that. So I can run through kind of quickly the sending portion, and we can I can highlight as we go along and pause and highlight a few different pieces of this. I'm just going to skip into the video quickly here. I'm just confirming. I'm just going to put this full screen so you can see this a bit better.
Yeah, looks good.
Okay, perfect. Okay, so in this example, very similar. We're putting together a letter. The video scenario we put together is that the lawyer's office can't receive MedDialog messages, so we're going to send them as a fax. Again, preparing the message, very similar to the law associates. We are pulling them up in our local address book. When I'm searching, I see that fax icon, so I know then they can receive those eFaxes. This is highlighting, again, the MedDialog message portion. And this is just another way of sending, again, the same shortcut, Control-Shift-F, to then send this outbound. And this is, again, just highlighting the fact that you can then select the checkbox, green bar additional items to include other items with this. And so notice, it's a bit hard to see behind the closed caption, but on my demo, that button said send as MedDialog. And you'll see here that it actually says fax instead. So again, the exact same workflow, but we're creating a fax here. This is just showing the fax later functionality that a physician can go through and just choose the fax later, and then later staff can open up that chart and finish sending that off to the correct recipient. We built in this new section, obviously, that needs printing. There's a new tab for needs faxing, same idea. And so here's our fax options. So similar to MedDialog, how that popped up with the message box, here we've got our fax options, who we're sending to, confirming the number, recipients, et cetera. I can choose to include a cover page. I can look at my PDF preview. And it's just highlighting the cover pages of the special forms, obviously, but we're just using the generic one in this example.
So you can create template cover pages, is that what it is?
Absolutely, yeah. And so we've added our custom comments in there. Of course, if you prefer not to have it, leave the checkbox cleared. And to be really thorough in this example, we're looking at the preview before we send it. Again, very similar to how MedDialog, when you see that attachment, it shows you what you're sending. In this example, because we've included the cover page, it's showing that in the preview as well. And we're now able to send that. Again, highlighting on MedDialog, you don't really need that cover page because we've got the message and subject already in the MedDialog message itself. So you can add any sort of custom info there. And so that's sending outbound. Tracking the progress of those sent faxes is covered in another tutorial. That's for sending them. Again, in this training videos section under faxing, we've got a whole bunch of information or a whole bunch of videos. Just in the sake of time, because we've got 15 minutes left, I'm going to stop there on the eFax portion. But again, if you have specific questions, feel free to reach out. We can absolutely answer any questions or point you to the correct resources or video and information to answer your questions. So just going to stop here, and Yvonne, is there maybe one or two questions quickly on that I can answer, or should I?
What I see here is when you type it on the cover page, why is it not imported into the EMR/record? So I'm guessing they're confirming if the cover page is also added to the patient chart.
I believe, well, when you send out that is attached. So I think that PDF is still attached there. So I think that is still logged in the chart because that PDF is logged as being sent out from that chart. So
I guess you have to make sure that you click on cover page so that it is attached as a whole PDF to the patient.
Correct. Yeah.
Next question I have here. If you already have an eFax referral, is there an additional cost for MedDialog?
Sorry, can you repeat the question?
If we already have eFax referrals, is there an additional cost for MedDialog?
If you already have the eFax product, like Telus eFax, it is just a different pricing structure to switch from eFax to MedDialog plus eFax. I'll go over the pricing information on a slide coming up here. And sorry, just looking at the chat, I did see a note there, a few people mentioning that the PDF itself does not fully attach to the chart. Let me take a look at that. I'll investigate that a bit further and follow up. If that's not working as intended, we can absolutely look into that further. But yeah, apologies, I'm not meaning to mislead anyone that way. So I'll personally look into that after the fact, and we'll follow up on that in our Q&A document. Okay, so just for the sake of time, again, just going to go through. I know everyone's interested in pricing and all that, so I'm just going to pull that up here, and we'll continue through. Just bear with me for one moment. Okay, so back to the slideshow here. So again, just reiterating, MedDialog allows you to then gain that operational efficiency, sending right from your EMR. All patient data transmissions are secure and compliant with all regulatory requirements. MedDialog is encrypted end-to-end, but it's all kept within Canada for both eFax and MedDialog, of course. We facilitate the continuity of care and enhance patient safety by receiving those automatic confirmations of delivery. And then for e-consultations, there are those fee codes for Alberta and Ontario available right from your EMR. So let's jump into those because we've had a lot of questions on those. So for the fee codes, MedDialog does offer access to this new revenue through e-consult fee codes. So in this example, we're looking at Ontario specifically. As I mentioned before, there are codes available in Alberta. So if you're an Alberta user, we absolutely can give you that information. So these allow for a physician to send questions about recommended patient treatment or care to a specialist. The specialist can then respond with advice or requirements around when a referral is required. And when that loop has happened and the request and response both are sent via a secure electronic network like MedDialog, the fee code can then be billed. In Ontario, the fee code can be billed a maximum of 400 times per physician in a calendar year. And in this example, we've assumed 25 e-consults per month, which works out to be 300 per year. Again, in this example, the referring physician would see returns of $4,800 per year, and the consulting physician $6,150. We do need to stress that this communication has to happen over a secure electronic network, not over eFax at any point. This is a great incentive, though, to help grow the network and increase the number of GPs and specialists on our network. There are also fee codes available in Alberta, as I was mentioning, for both the referring and consulting physician. For those users, refer to 0301R and 03010 in the AMA Fee Navigator website, or contact us and we can get you that information. Other provinces are working on similar e-consult fee codes. Today, just Alberta and Ontario have it publicly available and it's ready to go, but please refer to your local ministry or provincial body for timelines or questions around that. So just highlighting here quickly, the referring physician, so like a GP, $16 per message with just 2 messages per month. That actually more than covers your MedDialog cost. So it is a big kind of incentive there. Just before we jump into pricing, just again highlighting the time savings. So we've shown kind of how with MedDialog, you select who you want to send to, and it just sends out. It attaches the patient information. It automatically files to the chart on the other side. You know, the biggest time savings is really just that single send button and the response coming back without needing to import or categorize. And that's how we get to this kind of 1.5 hour example. There are a few other kind of workflow examples. With Telus eFax itself, it obviously still is a lot of work to file those incoming faxes. For eFaxes, you do still have to attach those to charts, right? It's an image that's coming in. So we understand there's a lot of work involved with that. But of course, until the MedDialog network is built out over time, we do still get a lot of time savings with that Telus eFax over the typical scanning and uploading workflow, or having to have that fax print driver that has no linkage at all to your EMR address book. Earlier, we discussed partnering with several external vendors, and we are excited to announce our first partnership with secure communications provider BrightSquid. BrightSquid is a secure messaging platform that operates primarily in Alberta, but it supports secure messaging between providers and even with patients. MedDialog integrates with BrightSquid's secure mail platform to allow MedDialog users to send messages to BrightSquid users and BrightSquid users to send to MedDialog users from their secure mail product. BrightSquid went live with MedDialog last year and brought new providers onto the MedDialog network with that launch. Obviously, as I mentioned, they are primarily in Alberta. I understand a lot of the users on this webinar are Ontario-based, but we are actively working with new partners to bring onto the network. We understand there are provincial networks like this across Canada, such as OTN Ontario MD. So you will see the MedDialog network grow over time as we bring new partners like this onto the network. All right, so let's go on to MedDialog pricing. Obviously, this is a very hot topic, so we do offer MedDialog with Telus eFax bundled together, again, including unlimited fax pages and MedDialog messaging for a flat monthly rate of $30 per provider. We bundle the two services because we know that a lot of the providers you communicate with may not be on the MedDialog network today, so having that eFax fallback is crucial. For the $30 plan, it does require that all MDs, nurse practitioners, and allied health professionals in your clinic sign up, just because that unlimited fax usage is shared by everyone. So we're enabling unlimited fax for your clinic, but if only one or two MDs have signed up, that could be a lot of faxing just for those two doctors. E-faxing in MedDialog can be used by MOAs, RNs, locums, residents, and anyone else in your clinic at no extra charge on behalf of those practitioners. Essentially just those in your clinic who are providing the primary patient care, they have to be registered. Anyone else that are support staff or nurses and stuff like that can use it at no charge. If your clinic has any part-time providers or you have 9 or more providers in your clinic, contact our sales team and we can help review all the options for your clinic. We understand, there may be some doctors that only work 1 day a week, et cetera, so we can look at working with you on that. I'd like to highlight again for our users in Ontario, using those e-consult fee codes, if a referring physician does just 2 e-consultations each month, with a consulting physician over the MedDialog network, that monthly $30 cost is already paid off and then some. The exact same goes for the specialist in that scenario. Another thing to note is that standalone eFax pricing is available, but our MedDialog and eFax bundle is priced competitively to help us grow that MedDialog network. In most cases, the MedDialog bundle actually works out to be better value for our customers because of that full resolution sending, e-consult fee code potential, and other benefits we've discussed that comes with MedDialog. But our sales team can present all options for those interested. And this is what I just wanted to highlight earlier as well, with the help files, having a lot of information on MedDialog and eFax available today. Even before you sign up for the product, feel free to go in there, search for MedDialog or eFax, watch the videos, read the little clips and stuff that we put together. There's a ton of information there to help you make kind of an informed decision and understand what the product looks like and how integrated it is into your EMR. So again, in the help.pssuiteemr.com, feel free to search for MedDialog content just by searching for the word there. And actually, I'm just going to pause here and pull up the live example again. Just bear with me for one moment here. And I'll resume. Okay, so back in the actual live help files here, again, under the faxing, this is under the More section and training videos. So when I click through to that, we've got a section on faxing here. So sending eFaxes, monitoring outgoing eFaxes, managing, etc. And then under MedDialog, we've got sending letters and other patient information, sending patient charts, and sending non-patient related messages. We are working on expanding this video library as well, so we're actively creating more content, uploading more videos. If you have examples of things you'd like to see here, specific to MedDialog or eFax, please reach out and let us know. We're absolutely interested in hearing that. And yeah, just showing, I guess, here, if I search for the word MedDialog, I get my return result. So if I click through here, we've got MedDialog highlighted here, but essentially we've got a lot of information with links to more kind of how-to guides, enabling providers to send messages on MedDialog. This is what we were talking about with your local contacts, enabling them. So there's all sorts of information here. The same goes for our eFax product. You can find all sorts of information. So I'd highly recommend watching a few of these. But again, if your questions aren't answered after looking at these, feel free to reach out, let us know, and we'll do our best to answer those questions.
Okay, we just have a couple more questions here, if you have some time. Are the rates prorated for part-time and occasional MDs?
Prorated. Essentially, like what we tend to do is we look at how many part-time providers you have and kind of what hours they're working. It is a case-by-case basis, so I don't want to say there's like hard rules around it, but essentially if you have a few part-time providers or providers that kind of cycle through, we don't necessarily need to bill each one of those at the full $30 rate. So we'll look to see and kind of compare the options. The other thing that gets a bit complicated with the MedDialog network is if you have a part-time provider that's only there 1 day a week, we may not want to list them on the MedDialog network to receive messages themselves because they're only there once a week, right? So if someone were to send an urgent referral or something through to that doctor and they're only there on Mondays, that could be an issue. So feel free to reach out to us and we'll look at it at a case-by-case basis and determine pricing and whether or not we list them on the network at your location. And again, another like kind of highlight there is around sending to location available later this year.
Is there an example of how a response to a message would look in the chart when sent through MedDialog?
I don't know if I have one available now just because we're running out of time here in 4 minutes, but I can absolutely either provide a link to a video or send some screenshots showing that in the Q&A document. So yeah, we'll definitely log that question and we can follow up and show you that. And
there's one more question. I believe there was a miscommunication in regards to the red needs printing. It seems that you need to understand if the needs printing on the letters. I'm guessing you would click on that needs printing note, and you're able to select it to either send it through MedDialog, print it, or fax it. Is that correct?
Sorry, yeah, the difference between needs printing and needs sending by MedDialog or eFax?
Yeah, so if you have a note in the patient chart, John McCracken, if I'm understanding properly, if you have a note in the patient chart that says needs printing and it's highlighted in red, you would then select it and you're able to either print it or send it by fax or send it by MedDialog. Is that fair to assume?
Yes. Yeah, you can choose accordingly.
Perfect. And how do you send a fax that is not related to the EMR? For example, how would I fax business documents to my lawyer?
So in that example, I think I'd refer to the help file. But I believe we put one together that's a part of the sending video. I can follow up offline, though, once we're done the webinar here to show that workflow. Just one, sorry, to jump back to the kind of the previous question of receiving a message. I'm just going to resume my screen here and show the EMR. I'm in a test environment, of course, so I apologize. It doesn't look like real data, but essentially showing here, I'm in my messages for Dr. Susan Pipers, and I've received a message here from someone on our Wolf platform. So this is kind of an example of what it would look like in my messages. This would also show on the patient's chart if the patient was already existing in my system. But in this example, you'll see there's some question marks next to the patient's name, and we can choose to identify. So as I was mentioning earlier, the patient demographic information is carried across as machine readable. So when I receive this MedDialog message and I haven't seen this patient before, I can click identify and, sorry, it popped up on the other screen. I can then choose to add this as a new patient or match this to an existing chart. So I don't need to actively transcribe that data myself. That's already put in there. But this is an example of a message I've received. I can also click to view, so we're going to cancel this. Click to view this attachment, which pulls up, and again, in full quality, this is sent from Wolf. to PS Suite here. So just an example of an incoming message. Apologies, I don't have one that's attached directly to the chart though, but I can definitely follow up with that after the fact.
Perfect. So incoming messages are coming into the inbox. So these messages for the doctor associated. And as you can see, as highlighted, there's a little MedDialog icon there saying that it came through MedDialog. You can add those messages directly to the patient chart identified.
Absolutely. All right, well, I think we're just about to time out here at 10 o'clock. So again, if you have any questions that we didn't get to, we are going to take a copy of the entire WebEx chat, so everything that was asked, and put together a document, like a Q&A document that will be emailed out. So if you've registered for this webinar, you will be on that mailing list to receive that document, and we'll look at getting that to you within hopefully the next week here, and go through those. If you have any specific questions or would like to kind of get a quote or learn more information, this Telus Sales EMR emails on your screen. If you have someone in the sales team that you work with regularly, please reach out to them. Everyone is familiar with MedDialog. And we do have more information, again, on the Telus Health website and on the PS Suite Health files. So I'll just pass this back to you, Yvonne, to wrap up.
Perfect. Thank you, Theo, for the presentation and answering everyone's questions. Thank you, everyone, for joining us today for our webinar on outlining the MedDialog solution. And as of right now, this concludes the presentation. Thank you.
Thanks, everyone.